Trauma-Informed Communication for Psychiatric Nurses. Building Trust with Vulnerable Patients. By Ivette Ray. And narrated by Madison G. Disclaimer. The information and strategies presented in this book are based on the author's experience, research, and understanding of trauma-informed care principles and communication techniques within psychiatric nursing. However, every patient situation is unique, and clinical judgment must always be exercised. The application of the information provided is solely the responsibility of the reader. Healthcare practices, regulations, and standards evolve over time. While efforts have been made to ensure the accuracy and currency of the information presented, the author and publisher make no warranty, express or implied, regarding the completeness, reliability, or suitability of the information. The case studies presented are illustrative examples and may be composites or altered scenarios designed to protect confidentiality and highlight specific concepts. They do not represent actual individuals without alteration. Preface. Nursing at its heart involves talking to people. Seems simple enough, doesn't it? Yet in psychiatric nursing, that simple act of communication becomes, shall we say, a bit more complex. We meet people often at their most vulnerable, carrying histories that aren't always visible on the surface, but profoundly shape their reactions to us, to the environment, to our very attempts to help. We learn standard communication techniques, of course, active listening, open-ended questions, the usual suspects. And they are good tools, necessary tools. But sometimes, quite often actually, they aren't enough. You see, many, a staggering number really, of the individuals we encounter have walked through fire. They carry the weight of past traumas, big T and little t, though that distinction often matters more to us classifiers than to the person living with the aftermath. These experiences rewire things. They change how the world feels, how trust works or doesn't, how safety is perceived. And if our communication, our words, our posture, the very way we enter a room, doesn't account for that rewiring, we risk hitting tripwires we didn't even know were there. We risk making things worse, even when our intentions are golden. We might label the resulting reaction resistance, or manipulation, or some other bit of jargon, when really it's a predictable response to a perceived threat, a ghost from their past projected onto the present moment. This book, then, isn't about adding some exotic new theory to your already overflowing plate. Heavens, no. It's about refining the fundamental
Sample complete. Ready to continue?